क्या आप या आपके परिवार में कोई डायबिटिक है? जानिए भारत के प्रसिद्ध डायबिटीज स्पेशलिस्ट से कि डायबिटीज को कैसे करें मैनेज। सीधे अहमदाबाद से, जहां देश विदेश के 5000 डायबिटीज एक्सपर्ट्स एकत्रित हुए हैं। डायबिटियोलॉजिस्ट डॉक्टर्स की एनुअल कॉन्फ्रेंस RSSDI में 22 से 25 नवंबर 2018 तक। लॉग इन करें फेसबुक पेज डायबिटीज पर चर्चा पे।
A public awareness initiative by IPCA Laboratories Limited.
We have Dr. Dishank Patel on Diabetes Per Charcha from RSSDI Ahmedabad. Dr. Dishank is consultant diabetologist at Glucoville Diabetes Center, Vadodara. Welcome, doctor, on Diabetes Per Charcha.
Thank you.
So, doctor, if you can tell us what makes Indian population more prone to diabetes?
Yeah, so nowadays we are seeing a more number of patients being diagnosed with the diabetes in India. That is why, because we as a Indian are genetically more prone to get the diabetes compared to the Western population, which makes us more prone to get the diabetes. Apart from that, the rapidly changing lifestyle in the India is also responsible for the more number of patients being diagnosed with the diabetes. Say for example, increased number of the, physical inactivity, increased tendency for the fast food, packaged foods, increased high calorie foods, and increased level of the stress in the population is also responsible for the more number of patients being diagnosed with the diabetes in India. So we can say the mix of the genetic plus lifestyle components are important why the Indian patients are getting more and more number of diabetes in India.
And on long term, what can be the complications of diabetes?
Yeah, so diabetes is basically a chronic disease. So if you do not treat the diabetes in the early stage, in the long term there can be many complications. The most common complication of the diabetes patient that can get is a cardiovascular disease. Patient can have a heart problem, patient can get the stroke, that is a paralysis. Apart from that, there are many microvascular complications which can also happen in diabetes. For example, patient may have eye problems, patient's kidney may get damaged, or patient may have a neuropathy, that may be autonomic neuropathy or the peripheral sensory neuropathy. So these are the common problems that a diabetes can get on a longer run.
So if we focus on neuropathy, that is the nerve damage in diabetes patient. So what do you think? What are the signs and symptoms of nerve damage, and can it lead to further complications in patient? And the most important thing is how patient can prevent it.
So neuropathy is also one of the dreaded complications of the type 2 diabetes, and many patients of the neuropathy, type 2 diabetes can get a neuropathy, and the initial symptoms can be a tingling in the hands or feet, numbness, burning sensation. The patient may feel loss of sensation in the feet. So these are some of the common symptoms of the diabetic neuropathy. Even some patient may be asymptomatic also, that we can diagnose with some special tests like monofilament test or a biostaciometer test. So these are the initial tests which can help us to diagnose the diabetic neuropathy. If the patients of diabetic neuropathy are not treated early, or they cannot feel the sensation in the feet, there is an increased chance of the patient getting ulcer in the feet because they cannot feel the sensation. This ulcer may get infected, then the patient may catch the gangrene of the feet, and ultimately it will lead to the foot amputation or toe amputations. So these are the common complications if the neuropathy is not taken seriously by the patient.
And how patient can prevent it? What precautions a patient can take so that it does not cause any kind of complications?
Yeah, so the neuropathy is basically a patient need to be make aware about the neuropathy so that he can be aware that his feet is not feeling well. So he need to take care of some of the precautions to prevent these foot complications. That patient should not walk barefoot. Patient should always wear a protective footwear that may not damage the feet. Then the patient should cut the nails properly, should not cut the nails from very deeply inside the feet. That can also damage the feet and create the ulcer. So these are some general precautions that the patient should take. Apart from that, to prevent the complications, one of the most common important factor to prevent the further foot complication is to take the sugar under control. So any patient having a neuropathy should take the sugar control seriously.
Thank you, Dr. Dishank. Thank you for giving us information on diabetes management and its further complications. Thank you for being with us on our talk show, Diabetes Per Charcha.
Thank you.